Spice FM, Nairobi.
At 6 minutes after 8 o'clock, good morning. Our audience on KTN, good morning. And also continue streaming on YouTube, Facebook, and on X this morning. Teeth sensitivity, smile, all of this. Think about when you bite into some ice cream sometimes and you do like that, or you tasted something really tangy and you're like, oh my goodness, what is that all about? Now imagine if you could have all your food, hot, cold, whatever, without that. But you don't have to imagine it anymore because Sensodyne says, you know what? We can actually help you out. Sensodyne, the toothpaste, talking toothpaste to you today. And you don't have to worry about tooth sensitivity anymore because it is the #1 brand recommended by dentists. Sensodyne says we deal with that. And World Oral Health Care Day is coming up. And because of that, Sensodyne also says, how about you get to that place where you can have your favorite foods, hot or cold, without having to worry about that sensitivity any longer. Step into your outlets of Chandarana, of Naivas, of Quickmart, and of Carrefour and get 50% off on select Sensodyne products from today until the 23rd of March, as we say that a happy mouth is a happy mind, and you can get into enjoying that again with Sensodyne. And that forms part of our conversation that we will be having this hour, even as we get into the second hour of Kenya's biggest conversation. And our guest is already seated in this hot seat today, and we'll be talking about Beyond the Smile, how oral health impacts the body and mind. If you didn't think it, now we're going to get into it. What's happening in here can affect what happens in here, right? Dr. Nzesia Mwende is an orthodontic and aesthetic dentist, and she's in the hot seat this morning. Dr. Ari, good morning.
Good morning. How are you?
Very well.
Thank you so much for having me today.
Nzesia.
Yes.
Yes. All right. I've never seen a dentist without a perfect smile. I just thought about it right now.
Thank you so much.
I haven't ever seen a dentist that smile is not tip-top. I guess you take care of yourself before you do everybody else. It's good to have you here this morning. Karibu Sana.
Thank you so much.
So as you get into it today, CT goes, you may not have heard this, but you know, I've got the tea. CT goes to a different African continent every week. You can then imagine for yourself later how he does that.
Yes.
But then he comes back every week with a proverb, rather a number of proverbs from this particular country, and then he shares one with us every day.
Okay.
So he's going to share it with us today, and we'd like you to give us your interpretation of it and what you would think of it.
Perfect.
Fantastic.
Yes.
Okay.
Our proverbs for the whole of this week are from the Republic of the Sudan, Africa's third largest country, Africa's third largest producer of gold.
Oh.
Thinking of gold teeth.
For sure, for sure.
The proverb: better your leerbob than people's dates. Now, this is a complicated proverb, so let me just explain.
Okay.
Leerbob is actually a herbal concoction that was used in ancient Persia for a wide range of things. Mind, this wide range of things was male infertility.
Interesting.
That's what they said it did. Yes. Okay.
That's what
Wow.
they said it did.
Yes, that's what they said it
Okay.
did. So better that than people's dates. We all know what dates are. Okay?
Yeah.
Yes, exactly. So what do you think this proverb is saying?
Wow.
You can't be wrong, by the way. Your interpretation is precisely that, your interpretation. So let me rephrase it saying, better your own herbal concoction than other people's dates.
I think it simply means it's better to be involved in something that you already know about than, new information. They always say, like, better the devil,
And you put it so well.
Yeah.
Thank you.
Yeah.
Excellent.
Thank you.
Excellent.
Yeah.
Yes.
There you go.
Yes.
Okay, so every time we think about some health and we think about things that we need to do as concerns our teeth and oral health and all of that, it doesn't usually go beyond brushing your teeth and making sure that everything is okay there and then you're done. But here we are this morning having a conversation about how oral health can and would affect your mental space.
Yes.
And how it can actually promote good mental health.
Yes.
And so that's some of the conversation that we're getting into this morning. So I want to thank you again for being here.
Thank you too.
But even as we do, Daktari, what can you tell us first of all the difference between an orthodontist and just a dentist?
Yes.
Everybody who does anything in here.
Yeah.
And what an aesthetic
aesthetic dentist.
Dentist.
Yes.
Okay, so an orthodontist is keen on how your teeth look like in terms of alignment. We want to make sure that your teeth are very straight, they are not crooked, and this way you're able to brush better and also improve on your oral health. I don't know if you've seen people whose teeth are, we could see like some canines ziko juu kidogo. You find that some teeth ziko stuck inside, and in such a scenario you're not able to take care of your teeth better. So an orthodontist comes in and makes sure your teeth are straight.
Okay.
That way you're able to eat better, you're able to brush better, and you're able to smile better. An aesthetic dentist also plays a big role when it comes to, now aesthetics is more about appearance. Are the teeth well aligned? Are the teeth bright? When you smile, do you like it? So it's a matter of trying to make sure that your teeth look better. Yes. Yeah.
Okay. So when we think about that, how you look, but then how you actually use your teeth.
Yes.
What are some of the things that we need to be watching out for? We talk about, you bite into something hot, you take a bite of something cold, you're not able to crush ice or whatever it is. And Siti's looking at me like, who wants to crush ice? Some people actually do. And then you're really sensitive about that. What does that have to do with what's going on in here? Because then affects whether you're able to take anything hot, whether you're able to take anything cold, all the time.
So teeth sensitivity means that a part of your tooth is exposed. The tooth is made of something, the outer part of the tooth is called enamel. The layer just below that is called dentin. So enamel is non-living and the dentin is, part of it is living.
Okay.
So when you're experiencing sensitivity, it means your enamel is exposed and so is your dentin. So that time when you're experiencing sensitivity, it could be maybe you have a cavity, some part of your tooth is exposed, maybe you have gum recession, or maybe you've been feeding on foodstuffs that erode your enamel, mostly acidic foods, fruits that have citric acid in them, like lemon, and also sodas. Those kind of foodstuffs tend to wear part of your enamel. So those are the things that you're looking at when you have tooth sensitivity. Yes.
And then we're told that there are things that we can do, like if you brush my teeth with Sensodyne.
Yeah.
It's recommended by dentists,
Yes.
but then I can brush my teeth with that often, and then it reduces my tooth sensitivity.
Yes.
How is that?
It's because most of these toothpaste contain something we call stannous fluoride. Now, fluoride comes in and blocks those tiny pores in your tooth. Yeah. So, for example, you're taking a lot of lemon and your enamel is washed out. Now, fluoride comes in and blocks that outer part of your tooth. So, your sensitivity tends to go down. But in the event that you have a cavity, we recommend you see the dentist first so that the cavity is treated and then it doesn't progress.
What's a cavity?
A cavity is a hole in your tooth. Yes, it starts as a tiny pore and then now it just keeps progressing with time, especially if it's not attended to by the dentist.
Does it just come on its own, or does the tooth owner have something to do with it being there?
I like that question because most people do not know the process of a cavity formation. So it starts with you not brushing your teeth properly. Yeah. So you go to sleep without brushing. You wake up, you don't brush. So in that scenario, you have food in your mouth, and there is normal bacteria in your mouth. You have more than 500 species of bacteria in your mouth.
I
Yes, 500. Yes, between
As you are
300 to
now, like
500.
this now.
Yes, there's bacteria in your mouth.
Everybody's mouth has
Yes.
500 bacteria.
Yes, everybody's mouth. So this bacteria now works on the food. So your food that is trapped in your mouth for days. So the bacteria act on that food, and then it produces an acid we call lactic acid. That time, your pH has gone down in your mouth.
pH is what?
It's just either the acidity or alkalinity of your mouth. So in this scenario, your mouth is very acidic. And what does acid do? It leaches away, or it washes away the enamel. And then now your tooth gets exposed. Then with time, this cavity just continues growing. Yes.
But look, we find that there are those who say, why brush if I can just gargle some mouthwash and move?
Yeah. Okay.
So how integral is brushing, or
Yeah.
I'm supposed to use all these at the same time?
Brushing is a very mechanical procedure. It's just the way you clean your body, just the same way you will clean your dishes at home. So you have to use motion, circular motion, to remove that, we call it plaque. You know, when you eat, you in the mouth, you get a soft layer of food and bacteria that forms just around your gum area and also on your tooth. So you need to clean that out with brushing. So brushing is very mechanical. You can either use the manual toothbrush or rather the electric, but you have to clean that out.
It's not like you can't expect to pour a bucket of water over your body and expect to
Yes,
be
you
clean.
just can't pour your body. You just can't take your cup and splash water. You have to do the manual cleaning. So it's very mechanical and you have to clean that out.
You say it's mechanical and it has to go in a circular motion.
Yes,
Why
in a
circular?
circular
Because they're used to up, down, side, side.
So in this case, when you look at your teeth closely, you will see the gum. The gum, it hugs the tooth in like a semicircle. It's a semicircle, yeah? You will notice that pattern. So that is the natural anatomy of the gum. Any other movement will disrupt that. So if you do horizontal, you're cutting that gum. If you do up and down, you're pushing that gum down. So you end up with recession, and also sometimes you cut part of the tooth. This is very common. We see it very common, especially for the elderly people, because it's something that takes time.
I can see you next time. I can see you. When you feel elderly and you're looking at me, I can see you.
So the motion has to be circular. Please remember, it has to be a small circular motion. We do not recommend any other motion.
Then there's the issue of brush. Okay?
Yes.
I understand brush because I also brush my shoes. That I get. What type of brush does one need to use?
And how long?
And how long
Yeah.
before you decide to replace it?
Okay. So let me start with the duration. 3 months or less. Yes, 3 months.
Throw the
or
brush
less.
away, CT.
Yes.
That brush, go throw it away.
Tafadhali, 3 months.
Looks good.
Throw it away.
Throw it away.
It's not looking worn out.
When the
It is softer.
bristles just start facing in all directions, it's not working. So 3 months, because toothbrush tends to accumulate a lot of bacteria. Basically brushing and then you're keeping it. So there's a lot of
Yeah, this bacteria is everywhere.
Yes, it's everywhere, even in your washrooms, it's everywhere. So you need to throw it away. Otherwise, you're going to accumulate a lot of bacteria, and then sometimes you end up with frequent infections that you can notice. You have frequent tonsillitis, you have frequent coughs. So every 3 months, we recommend dispose your toothbrush and get a new one. Now, the choice of selection of the toothbrush, I think it's very dependent on what you're looking at. People with active gum disease, we recommend very soft and firm toothbrush. For the kawaida patient, or rather someone who doesn't have active gum disease, we'll also recommend something firm and also stronger. So it depends on what you're looking at. Because if you have active gum disease and you use a very firm or strong toothbrush, you're likely to cause bleeding gums. So it depends on what you're looking at. But either way, make sure that the toothbrush that you're selecting fits the size of your mouth. With small mouth, you don't like the big one, it's gonna hurt you. So you just need to look at the needs of the patient, and then we advise further.
Active gum disease, what is that?
Active gum disease means that your gums are inflamed, your gums are bleeding, your gums are swollen, your gums are not healthy at all. And in that scenario, you find that most patients also tend to have what we call halitosis, or rather bad breath, especially in the mornings. So we recommend cleaning every 6 months, or rather once a year for people who are not able to do the biannual cleaning. We also recommend mouthwash, at least daily use of mouthwash that has active ingredients so that you're able to treat that. Sometimes gum disease will also be very, very common in patients with other systemic conditions. For example, people who have diabetes, those people will tend to notice that their gums tend to have, they'll show signs of gum disease. Yes.
So, Doc, two things. What are some of the common conditions that patients present to you on a daily basis?
Yeah.
Plus, the most important aspect, how we store our brushes, because nowadays our bathrooms have toilets in them. How should we store our toothbrushes after use?
Let me start with the common conditions. Surprisingly, the oral healthcare seeking behavior has tremendously changed in this country. I think for the last 5 years, we used to see in between 2010 to 2017, we used to see lots of patients who are more of, doc, my tooth is painful, I want it removed, I am having sensitivity. But from the year 2020, there is a drastic shift. People are more keen on cosmetic procedures. Like, doc, I feel like my teeth are brown. I want them whitened. I feel like my teeth are not well arranged. What can we do? So there is, an uptick of cosmetic procedures recently. And that is something that we as dentists are proud of, because oral health care is very diverse. We are looking at your, how you smile. We are looking at how you're able to eat. We are looking at your overall well-being as a person. Are you confident enough to even go for interviews? Is your smile giving you that extra boost? Are you able to feed well? Because for kids, when kids are growing up, between the age of like 3 to 6, at that time they have milk teeth. And some parents will say, hizi tu ni meno za utotoni, we can remove. But then you forget that these are the same teeth that the child is using to feed on. And if that child is in pain, if that child is not able to enjoy their meals, definitely they are not going to grow up well. Yes.
Okay.
Yeah.
What are some of the most,
there was, sorry to cut you short, there was a question on storage.
Storage, right.
Some people don't know how to store their toothbrushes. Yeah, so you find that they accumulate a lot of bacteria and stuff like that. So we are saying, after using your toothbrush, make sure that you store it in a dry place, and also make sure it's just make sure it's upright, so that it doesn't stay moist for long. Because if it stays moist for long, then bacteria will enter, and then they'll just keep multiplying in that case. Stay it away from your toilet. You go to the toilet and then you flush and bacteria is all over. Where do they go? They land everywhere. Yeah. So make sure that when you're storing your toothbrush, it's in an open but dry area.
Yeah.
Some people also tend to lock it. There are some toothbrushes that are in a case. That's not recommended. Yeah, because it means that your toothbrush will be moist most of the day. You only use that case when you're traveling. Yeah, it's just basically for travel. At home, you can also have a storage for toothbrush. It comes as it's like a tiny box. Then you can just stock your toothbrush in there. That way, it's dry. It doesn't accumulate bacteria.
Okay.
Everything you've said presupposes that the person who wants to have healthy teeth has money. Toothbrush, money. Mouthwash, money.
Flossing.
Money.
Toothpaste.
Money.
Good smile.
No money. How do you get people to take care of their teeth if they can't afford some of these things? What do they need to do to ensure that at least they maintain a minimum standard of teeth care?
That's a very interesting question, but I also like it so much because I feel like people tend to neglect oral health. you'll find that, let me ask her, what's your name?
Dennis.
Dennis.
Yes.
That's his name on Thursdays. Ask him what his name will be tomorrow.
All right.
Dennis will not forget his haircut,
Yeah.
but he's gonna forget his teeth.
Allegedly.
Why do we have that kind of attitude when it comes to seeking oral health care? So I feel like oral health care is part of your self-care. You see, the way as ladies we work every month, we have our appointments booked for facials, we have our appointments booked for nails, but we do not have our appointments booked for the dentist. And you cannot say it's because we don't have money. It's just because we have neglected oral health care, and it's very important. So the issue to do with money, I feel like it's attitude and also the lack of awareness. Either way, I get to understand that it's not, I wouldn't say like it's easily affordable for every Kenyan, but with proper planning, because we will do cleaning twice a year. Ladies will do their nails every month, which is more expensive when you look at it that way.
I wouldn't.
Which is more expensive,
Yeah, for
honestly.
sure, the nails are more
I do
expensive.
not think oral health care is expensive. I just feel like oral health care is neglected and we do not talk about it enough.
My reference point here is a large population of citizens who live in the rural areas.
Yes.
Again, in terms of priorities, you are right.
Yes.
The teeth tend not to be a priority for many people.
Yes.
Till they fall out.
Yes, until they really fall out, and they tend to.
Yes.
Now, given what is available, again, my question is the alternatives.
Yeah.
I remember as a child,
Yes.
there were certain shrubs that we would, or certain trees
Yes.
that we would take a certain twig off, and that was used as a brush.
Yes. We personally, I grew up using that brush and it worked just
See, it works.
good enough. Yes.
Yes.
It worked.
Yes.
That's why we are saying this thing is more of mechanical. Bora to there is that brush
Cleaning.
and that movement, then you're good to go.
Okay.
Yes.
How does oral health affect your overall health? You know, because we just think about it as your teeth, your tongue, and your mouth, and then you're done.
Yes.
We don't ever think of that it can affect something else. So how does it affect the rest of your health, Dr. Terry?
There's a very strong relationship between oral health and also your general body health. Look at it this way. The mouth is the entry of everything in your body. What you take, what you feed. So we are looking at, are you able to enjoy your meals at the end of the day? Are you able to psychologically, I don't know if I'm using the correct word, but does your smile give you confidence? There are some people that for sure, from what you've seen in our practices, like oral health has really, really affected their self-esteem. Kids who have been brought up in areas that have salty water, they have a condition called fluorosis. Their teeth are very brown. These kids can get bullied in school, and this can affect their whole self-esteem. We are looking at also things to do with gum disease. The way I've said, there's a very strong relationship between gum disease and diabetes. There's also a very strong relationship between your oral health and pregnancy. There are kids who have been, mothers who have delivered kids with low birth weights because of bacterial transmission from your mouth to your body system. And this affects your pregnancy. So I feel like the issue, we cannot neglect oral health because your whole body is dependent on your teeth, what you consume, what you're able to take, your own image. Yes. Yeah.
Let's take a break at this point, and we're looking at oral health this morning, and we're talking about Beyond the Smile, how oral health impacts the body and mind, and coming up to World Oral Health Day, and some of the things that we do actually need to take into consideration. Dr. Nseya Mwende is here with us this morning, and we're looking at some of those issues and saying, you know what, the time has come for us to not just talk about, you know, just brushing your teeth and it goes and that goes away, but things that we can actually take into consideration to make sure that we do so that our overall health is taken care of, even as our oral health is. We're going to take a break and come back and discuss more on that after this. Good morning. It's 8:30.
Why should we care about forests? Because they provide food and environmental benefits, which are essential for sustaining life on Earth. Over half of humanity uses forests for medicines, livelihoods, and food. Forest foods offer essential nutrients that sustain millions of people, especially for those living near forests. From fruits, nuts and honey, to edible insects and mushrooms, forests are nature's supermarkets. Healthy forests are also home to the pollinators that help crops thrive. By enriching soils, providing clean water and balancing the climate, forests sustain agriculture, which puts food on our tables. Indirectly, we all depend on forests. To safeguard our food and livelihoods, we must manage our forests wisely. Nurture the forest to nourish the people.
Cabinet Secretary for the Ministry of Environment, Climate Change and Forestry, Aden Duale EGH, will preside over the International Day of Forest celebrations at Kapchumbe Forest Block, Bomet County. The event will also be marked in the other 46 counties across Kenya. All are welcome to engage in tree planting.
We value your feedback and welcome your comments, queries, and complaints regarding our content. You can get in touch with us via SMS on 22151. Call 0719-012450 or 0719-012090 or email feedback@standardmedia.co.ke. Our PO Box number is 30080-00100, Nairobi, or deliver it to our offices at Standard Group Center, Mombasa Road, Nairobi.
Sasa nikuulize. Hii daka umekuwa unacheza how long?
Unajua hii daka nimeambiwa na rafiki yangu Chusi. Sasa nikasema acha nijaribu. Hata sasa sitamaliza miezi 3. Mimi ni mmoja Bernard Korir, natoka Transmara.
Niliwaambia aje? Niliwaambia napeana 100k. Ndo hii ingine hii pesa. Unaona ikikusaidia aje?
Nilikuwa napanga kuanza biashara lakini sikuwa na capital. Sasa nimeangukia.
Biashara gani hiyo unataka?
Nilikuwa na target ya biashara ya kuanza ya nguo. Watu wangu. Nimeamini sasa. Daka ya mamili ni ukweli kabisa.
Ulicheza na ngapi?
Mimi nitumia mbao. Ndio anatumia mbao nikatumia mbao.
Unasema ukutupa mbao.
Omoka na daka mamili every 20 minutes. Multiply bet yako times 5,000 killer draw. Ukicheza na 20 bob only una daka laki yako. 40 bob wins you 200,000. Ukicheza na 100 unashinda nusu milioni. Millions to be won every day. Cheza daka, pesa bika na washindi. Ni rahisi. Nenda kwenye paybill 440 account KTN, amount shilingi 20 hadi shilingi 2,000 and get your cash direct to your M-Pesa. Cheza daka.
I think things that people are doing at home could cause detrimental effects to your overall health. If you need to whiten your teeth, come to the dentist. The materials that you're using at the facilities are materials that are scientifically proven to work, and they are materials that will not damage your enamel. You know, we talked about the enamel being the upper protective part of your teeth. So going to use, baking soda, going to use abrasive charcoal, especially charcoal. Charcoal is very, very abrasive. You cannot use it to brighten your teeth. You will be washing away that part of your enamel, and the next time your teeth are sensitive. So those do eyewears, I do not recommend. Please stop hurting your body, because today we are talking about oral health and your general health. Stop hurting your body. come to the dentist.
Back onto teeth sensitivity. Once you wash that enamel, washing away and then exposes your tooth, obviously.
Yes.
Is that situation reversible?
Yes, it's reversible. It depends on the extent. Definitely, if you've used abrasive food stuffs like the charcoal and if you've cut the enamel, then it's not reversible. But if the enamel is intact, and you see the way I'm talking about stuff like lemons, those ones can be reversed, because if you use toothpaste that has fluoride, the fluoride is able to repair that part. But at the level that the enamel is cut, it's not reversible. Yes.
Okay.
Yeah.
But you can continue using, use those toothpastes and things that will at least help with that sensitivity. How will you know when sensitivity is so much that something may actually be may actually be very wrong with the teeth?
Okay. So for sensitivity, you observe for 2 to 3 days. You use desensitizing toothpaste and observe for 2 to 3 days. Anything past 3 days, it means to be checked by the dentist. It means your teeth are actually exposed. And in cases where the tooth is exposed or cut, then the dentist will go in, examine. Sometimes you may need a filling. Filling is a cover that you put on that area to protect that. Or things could be extensive. Your roots could be exposed. In that case, then the gum specialist will come in.
Okay.
So anything more than 3 days, you need to visit us.
Okay.
Yes.
What top 3 things are we telling folks to do every day to ensure that your oral health remains optimal?
On the daily, brush your teeth. Brush your teeth in the morning, brush your teeth at night. They say brush in the morning for your friends, brush at night for your oral health. So we are saying 2 to 3 minutes. Sometimes we may have to go up to 5 minutes, depending on your oral health, because people with crooked teeth, they may need extra brushing aids just to take care of that plaque. We're also saying floss on the daily. Use a dental floss. Nowadays, we have so many options for flossing. You could use the thread, just not the one that you put in your teeth and just pull out. You could also use the electric flosser, which comes as a nozzle with water. You're able just to work with it in your mouth. You could also use the interdental brushes. It's very tiny brushes that can go in between your teeth to remove plaque. So you have to floss. Number 3, use a mouthwash. People don't use mouthwashes. Why are we not using a mouthwash? Yet it's able to clean most of the bacteria in your mouth. And also some mouthwashes come with fluoride that enables repair for your teeth. So at least brush, floss, and use a mouthwash.
What's the name of the association that dentists like yourself belong to?
Kenya Dental Association.
Okay. Now, Kenya Dental Association. What is it that Kenya Dental Association has done over the years to make these messages accessible to the citizenry? One, I'm back on that story of people who live in the rural areas and probably don't have. I'm not leaving that story.
Yes.
The bulk of our population in this country tend to be in the rural areas.
Yes.
I'm not saying that everybody in the rural areas can't afford it,
Yes.
but there are very many people, even who live in town, okay, especially in the disadvantaged economical areas, who can't afford these things.
Yes.
And yet they all need to take care of their teeth.
Yes.
The messages and the efforts that the Dental Association has made towards ensuring that people understand this message.
We've personally, me being a dentist, we've gotten a lot of support from the association. They also have gone ahead and partnered for sponsorships and grants to support treatment in rural areas. For example, the last 3 days, we had a group of like 10 to 15 dentists in Masai Mara offering free dental treatment for kids who cannot access oral health care. It's a children's home setup whereby you're able to go and just offer free services for people who cannot be able to afford that. And I believe for the last 3 days, they've seen more than 1,000 patients. People who don't even know about it. They're able to do root canals, they have done cleanings, they have done fillings, they've done whitening and things we call veneers. So I feel like the organization is really supporting these communities in terms of accessing oral health care. The organization is also really championing when it comes to, SHIF and SHA, stuff like that, because you find that SHIF gives 2,000 for a whole household for treatment, dental treatment. That amount cannot even cover for consultation in a properly set up dental clinic. So we are really trying to fight hard so that, these policies that have been made, they can be inclusive and everyone can be able to access oral health care. So the organization is really working hard to make sure that Kenyans can access oral health care.
Okay.
Yes.
Now, World Oral Health Day. Your mouth is about a happy mind. A happy mouth is a happy mind. Now, what does this really mean as we observe this day?
Today, I think the dentists are very excited. I think you'll see most campaigns. We have, I think there's a campaign along Jogoo Road, Amsa School. There's another campaign in Makueni. We're trying to make sure that everyone can be aware about oral health care and its impact in terms of your oral health. Because if you have a healthy mouth, then you're basically growing a healthy nation, and people are able to take up their roles better. You've seen people who have extreme cases of tooth pain. Even sometimes you can have swellings, and you're not able to perform. You're not able to work. And we are saying if these things can be prevented through proper brushing, and people don't even know that you should brush in the morning and at night, and you do not know that these conditions can actually be prevented. So we are really trying to push hard so that people can get this information, and if it's something that you can prevent and it can improve your daily working routine, then it's something that we need to talk about.
Okay. A couple of questions are coming in. I think that they form part of the conversations that we have. The question here about what is the best kind of toothbrush to use with someone who has hemophilia?
People with hemophilia tend to, their gum health tends to be different because it can bleed easily, and also during the bleeding does not stop.
Right.
Yeah. So we recommend a toothbrush that is soft and also firm. Do not go and get a toothbrush that has these bristles. These toothbrushes that the bristles are very, they are pokey. They are pokey. And those kind of toothbrushes, will find the cost will range like between 30 bob or something of the sort. Now that brush will just hurt your gums. So in that case, you're recommending a toothbrush that is really soft and firm, so that you don't traumatize your gums. And in the process, because if you traumatize your gum, you're also exposing your blood to bacteria, and we don't want that to get into your bloodstream. So soft and firm, very soft. Yes.
Okay.
How do you make oral health a common subject? Now, I've moved from the rural areas and I've gone to schools.
Yes. So schools will find we need to have talks to the kids.
Do you have them?
Yes, we do. We do a lot of
Is
talks.
it organized? I mean, how do you go about it? How do you ensure that you have these discussions? Now, let me move to a favorite area of mine. How do you talk, or have you considered talking with the Kenya Institute of Curriculum Development so that this aspect, when you inculcate this knowledge in a child, they grow up with it.
Yes.
Something they know.
Yes.
So, how do we ensure that this push towards ensuring that people understand oral health so they can seek it at a very early age, so that as they grow up, it's just something that is part and parcel of their lives?
Yeah.
Again, we are back to the Kenya Dentists Association.
So, I feel like this is both a role to do with the KDA, and also there is public participation to it, because the organization will support us in terms of documentation and also how we are able to access the schools. Yeah, I will, for example, say, Dr. Monday, I want to do a certain health talk in a certain school, probably just within the area or close to where my practice is. So I will go to KDA and they will be able to support that in terms of documentation. Now, when you go to the school, you need to find people who are already excited, or they're like, they already accept this whole idea about oral health. And that way, we are able to get the kids together, give them a talk, probably for 30 to 40 minutes, show them how to brush, show them how to choose a toothpaste, show them how to put the correct amount of toothpaste, and show them how to floss. And I feel like when this information is actually shared in a large forum, or when the kids are together, and also they tend to take it up better. Because sometimes we'll also go with what we call oral health diaries, or rather just a book to guide you as a child on how to brush. It gives you reminders on like when to brush, how to do it. So those activities, I feel like the organization really comes in handy in this support.
There are those who are of this view. It's anecdotal.
Yeah.
Nothing scientific about it, but they have this view that if you chew sugarcane, it helps maintain good oral health.
Yes.
Debunk it or just tell me it's absolutely true. Your choice.
I support it because we said self-cleansing foodstuffs will improve your health. Sugarcane comes with that juice. So you just eat and it cleanses. And it's also when you're done eating it, the waste.
The fiber.
Yes, it's like a toothbrush. So it really improves your oral hygiene. Yes.
And the sugar aspect.
No, that's natural sugar.
Natural
sugar.
It's processed sugar, that's a problem.
Yeah,
Natural sugar is fine.
is good. It's very good.
So there is also the aspect of, I think, oil pulling that is happening a lot nowadays.
The what?
Oil
Oil
pulling.
pulling.
What do I understand?
Exactly.
Oil pulling is it's a DIY thing that people do at home.
Stop. What's DIY?
Do it yourself.
That's what it is.
Yes.
Okay, then now what is oil pulling?
So now the oil pulling procedure is you take some oil, mostly
What sort of oil?
coconut.
I think it's coconut.
Yes.
Yeah.
And then you just
Just
get it into your mouth. Then you keep swishing for 10 minutes.
What is it supposed to do?
What people say it's supposed to do, because it's not in our books, it's not scientifically proven, is that it picks bacteria. And then when you spit out, then it cleanses your mouth. Now, I do not support that because...
Coconut oil.
Yes.
It's happening, City.
Mafuta
It's actually a
nazi.
question that has been
No,
asked by one of
I'm
our
not
members,
doubting that it's happening.
Yes.
I'm just wondering, okay, if it's coconut oil, okay, why not then just sunflower oil? Well, why coconut?
Exactly. That's why I'm saying there's no scientific background to that, and I wouldn't recommend.
Yeah, so what I hear you, Doc, say is that there is a lot of misinformation that is out there when it comes to taking care of our teeth. And the most important thing that we need to do is to come for professional advice and treatment from dentist. Now, as this day is being observed, one would ask, there is your association that we can come to,
KDA,
that we can come to, but then again, there is the aspect of how many dentists do we have in the country, and can they meet the population, and if not, what should the government do?
We do not have enough dentists for sure, because as you're speaking currently, the number of practicing dentists in this country is less than 1,000. And we are a population of, remind me, 50 million?
55 million.
So if you do that ratio, it's
ridiculous.
It's ridiculous. We are not even close to that.
What's the problem? Are we not having enough dentists trained, or are we having more dentists trained and not hired? Where is the gap?
The gap is, from the training. I think annually the uptake of dentists for dental school is normally, I think, around 50, between 30 to 40.
40?
Yes, because we do not have enough resources to train dentists in this country. Or rather, that is what the government will paint to us, that we do not have enough resources to train dentists. So for sure, we don't have enough dentists in the country. And I feel like the government needs to take this more seriously. Because how do you train? I think for medical officers, annually you'll find almost 300 to 500. How do you compare that to 30?
You can't.
You
I mean,
cannot.
even if we tried very early in the
Yes,
morning, I don't
we
think
can't.
we can actually compare that.
So it starts at that. The training is not, we do not have enough dentists being trained in the country. And also that has led to a very huge gap in terms of people being able to access oral health. Because you will find, to make it worse, even with those few dentists, find that we are not even being employed. Personally, I've never been employed by the government. So you get out of school from internship and you're just like on your own. You're not assured of a job. And that's why personally I ventured into private practice early, because the government was not going to employ me. Or rather, there were no vacancies, or rather, we are not getting employed.
What did you say the ratio was? Dentists to, some says 1 to 33,000.
Yeah, it's really...
Some 1 to 50. Now, surely.
It's ridiculous.
Yes, it is. But,
Yes.
but also, if I look at other disciplines in medicine, I look at the ratio of people to doctors is equally interesting to observe. But
Yes.
there are other medical practitioners who are not doctors who help provide services.
Yes.
What about dentists? Do you have dental technicians? Do you have people who are trained in the field of dentistry who are not necessarily doctors?
Now, interestingly, the government is willing to employ the diploma level of training. So you find beneath dentists, we have another cadre of community oral health workers. And
Community
Yes.
oral health workers.
Yes, and the government is giving jobs to community oral health workers compared to the dentists. Reason, dentists are expensive to employ. But then I wonder, isn't just your whole health, isn't oral health a priority?
Indeed.
Yeah.
Okay.
Yeah.
I want to go to one thing, and it's kind of in link to what we talked about, in the rural areas. I mean, not even just, but also urban areas as well. And the use of salt is a big issue. People say, well, if I don't have toothpaste, I can put salt on a toothbrush, or I can make a mouthwash out of water and salt to then be able to use mouthwash being one of the things that you said we must do every day, Dr. Harry.
Yes.
Does that work? Or would you recommend that?
You cannot brush with salt for sure. You cannot brush with salt, but for gargling, you can gargle with warm salty water. It tends to fasten your healing, especially after an extraction. But for daily brushing, no. No, salt is not recommended.
Okay, Dr. Harry says no. How often are we to be seeing a dentist?
You should see your dentist at least twice a year, for routine checkup. Just checkup and cleaning, Even sometimes when you feel like your teeth are clean, you need to go to the dentist so that you can have that cleaning done and also professional checkup. Now, some people will feel like, my mouth looks okay, my teeth look okay, I don't need to go to the dentist. And at that times, a cavity could be falling, could be forming, sometimes in between your teeth, cavities that you don't see. That's why when you come for the checkup, you're able to do so much for you. You're able to diagnose something that is just in the initial stages, and it's cheaper to treat that way, and it's less invasive. So we'd say, come twice a year, every 6 months. Yes. Yeah.
The discussion around oral health is, when it's like discussing an intergalactic element that we're not familiar with, and yet it lives with us. I'll tell you why I'm saying this. When we have discussions on health, dentistry hardly ever features, and yet its importance cannot be overstated.
It's very important.
No, it's extremely important.
Yes.
Now, I'm not going to talk to the Kenya Dental Association. I mean, the thing is, what do we need to do so that when we talk about health, when we have activities that revolve around health, that much as we talk about public health and everything else that has to go with it, or community health, dental health becomes part and parcel of that conversation?
We need we strongly need to change the policies. Policies that are governing healthcare in this country. You cannot neglect oral health. So, in the discussions that are any discussion around healthcare in this country, you will find that dental,
just a little bit, yeah.
So the whole governance, we need to change. We need an overhaul of the whole system and say oral health is just as important as any other part, because we'll find maternal health care, people are talking about it. Nowadays, even mental health care, everyone is talking about it. But how far are we willing to go in terms of oral health care?
I mean, usually some disaster happens before we actually take into consideration. Maternal health took such a big, chunk of everybody's attention because babies and mothers started to die.
Yes.
That's the truth.
Yes.
That mothers would die during childbirth, and that babies would also die, preterm.
Yeah.
And then after delivery, in a few days, babies would die.
Yes.
And that happened with such in a rapid movement, and it happened with a higher occurrence, and so we started to pay attention. Mental health, we had people then starting to do really bizarre things, which is the case. Abuse of alcohol, abuse of drugs. We had murders taking place, and then somebody sat up and said, okay, let's do something about it.
Yes.
Attention was paid to cancer because prominent people started dying from cancer.
Yes.
This is just the truth.
Yes.
That terrible things usually need to happen before we start paying attention to something.
Yes.
It sounds terrible, but that's the case. Now, when we look at oral health, sadly, if something terrible doesn't happen, the likelihood of us paying some rapt attention to it is low.
Let me tell you, terrible things have happened.
Okay.
It is just that we do not talk about them. We have seen, I did my internship in the country, Kenyatta National Hospital, just here. And when I tell you about the prevalence of oral cancer in this country, it's crazy. Something starts in your mouth as a tiny ulcer. No one talks about it. No one ever talks about oral health. It keeps growing. You're just there. You're not aware about it. By the time you're coming to the hospital, this is cancer that has gone up to grade 4.
Oh dear.
Wow.
Let me tell you, terrible things have happened. It's just that we are not talking about it. And as dentists, we are gonna be talking about it. You will be seeing us very often in social media, on the screens, just the same way we've done. I think for the last 5 years, we've really made oral health something in this country. We've been talking about it. We've been sharing on our social media handles. We've been talking about it. We've been telling people it has been like this, but it's now different. People have not been going to the dentist. If you notice an ulcer in your mouth that has persisted for more than 2 weeks, please go to the dentist. We need to talk about how chewing mirror predisposes you to oral cancer. Smoking, how it predisposes you to oral cancer. Those are the discussions that we need to talk. And people need to know about the situation. You go to Kenyatta National Hospital, so many admissions for oral cancer. People do not talk about it. So we will keep talking about it. We will keep talking about the things that we want to change.
Indeed.
We'll keep talking about people who have had extractions or other treatment from unqualified dental professionals. And those people have ended up in admission wards, and those people have ended up losing their lives.
Important conversations for us to have, and it's not incidental that we have those conversations in this room, and necessary for us to keep talking about them. I want to thank you very much, Dr. Nzea Mwende, for joining us this morning as we looked into a number of these issues. Not to forget, you can get 50% off your Sensodyne product at any of your Carrefour, Naivas, Quickmart, or Chandarana today in celebration of World Oral Health Day until the 23rd. Get 50% off select products. And that has been our conversation for this morning. Thank you so much. Good morning. It is 9 a.m.